Okay, go ahead.
Hello, class. We're excited to be with you and explain to you what we have learned about the Joint Commission. Our team is made up of Elizabeth Ernest, Brian Fenn, Rebecca Rollins Randall, myself, Jennifer York. Let's learn about the Joint Commission. What does accreditation mean? The word accredit is defined as to give official authorization to or approval of. The second direct definition in Merriam-Webster's dictionary offers the best idea as to what accreditation to the Joint Commission means. Quote, to recognize or vouch for as conforming with a standard, end quote. According to the Joint Commission, if your healthcare entity has accreditation, it means it performs to their level of standards they have set. The benefits of being accredited means a variety of things, but the top two benefits are to help organize and strengthen patient safety efforts and to strengthen community confidence in the quality and safety of care, treatment, and services. When was the Joint Commission founded? The Joint Commission was founded in 1951 in Chicago, Illinois. It was a nonprofit, independent organization that bared the name Joint Commission on Accreditation of Hospitals. By whom was the Joint Commission founded? Sometime between 1910 and 1913, the American College of Surgeons was founded. As an objective of their organization, they used the idea from Dr. Ernest Codman that there should be a, quote, end result system of hospital standardization, end quote. As a note of interest, I would like to explain what Dr. Codman meant. Dr. Codman had the simple idea that every hospital should follow every patient it treats long enough to determine whether or not the treatment has been successful, and then to inquire, if not, why not? This was his idea of how to prevent similar failures in the future. By some time between 1917 and 1918, the American College of Surgeons had drafted a one-page document that was titled the Minimum Standard. Within the following decade, the ACS, American College of Surgeons, printed its first 18-page manual of standards. In 1951, the new corporation, the Joint Commission of Accreditation of Hospitals, was born based upon the standards the American College of Surgeons had built. It was made up of the American College of Surgeons, the American College of Physicians, the American Medical Association, the American Hospital Association, and the Canadian Medical Association. For what purpose was the Joint Commission founded? By 1952, the American College of Surgeons had transferred its program of hospital standardization over to the Joint Commission of Accreditation of Hospitals, and by 1953, they, JCAH, began to officially offer hospital accreditation. The overall purpose of the organization is to provide regulatory requirements for consistency in safety and quality in public health care. Now, what is the significance of the word joint? When the more integral parts of the medical community saw the need to have standards of quality and safety for all public health care, they joined together as one to ensure that there were standards accepted across all aspects of medical care. The organizations joined forces and came up with joint standards that would be acceptable to all involved for the betterment of public health care. The organization's name has gone through a few changes over the years. In the late 1980s, the organization became known as the Joint Commission of Accreditation of Healthcare Organizations. Due to its acronym, it was dubbed JCAHO. This name change acknowledged their expanded scope of healthcare activities. In 2007, the organization shortened its name to the modern-day version, the Joint Commission. As you can see, the significant word joint has always anchored and held a significant meaning in the name of the organization.
What kinds of organizations are eligible for Joint Commission accreditation? These include hospitals, which cover acute care, children's, psychiatric, and rehabilitation hospitals. These are small rural health access points. They are only accredited as short stay facilities up to 96 hours. Anyone needing longer stay gets transferred to a higher level of care. Credit ambulatory surgical centers, also known as outpatient surgery. Nursing care covers skilled nursing homes and rehabilitation facilities. Laboratory services are both clinical and pathology laboratories. Ambulatory care includes a variety of centers covering surgery, both standalone or office-based surgery, imaging, urgent care, kidney care, and occupational health centers. Home care covers palliative, hospice, and home health, which is when a provider, usually a nurse, comes to the home for continuation of care after hospital discharge. There is also a separate accreditation for equipment, which is known as DME POS, equipment, prosthetics, orthotics, and supplies. These are the people who supply walkers, wheelchairs, knee braces, home hospital beds, limb prosthetics, and more. Any type of equipment needed to advance patient care in the hospital or at home. And last but not least, behavioral health. This covers mental health facilities, both inpatient and outpatient programs, addiction treatment and recovery programs, specialized opioid treatment programs, teen behavior modification programs, and eating disorder programs, which is a specialty branch of mental health facilities. Just recently, Joint Commission updated the standards for accreditation for eating disorder programs and facilities. Eating disorders have the highest mortality rate of all the psychiatric health illnesses. In recognition of that, Joint Commission adapted standards that were developed over 10 years by an accreditation task force from Academy of Eating Disorders. So now, instead of there only being 2 additional standards in the Joint Commission Behavioral Health Manual, there is a whole subsection of standards specifically covering eating disorder programs. These took in effect July of this year. I went over this because my daughter has suffered with an eating disorder, so this was of particular interest to me. The joint version. Let's see, I need to get back over here. Just one second. Several competitors to the Joint Commission. The first one I'll cover is Detnorsky Veritas, DNV, or Detnorsky for short. In English, Detnorsky Veritas translates to the Norwegian truth. They offer accreditation built on 2 components, a set of hospital standards called National Integrated Accreditation for Healthcare Organizations, acronymed as NIAHO, and an additional requirement to be ISO 9001 compliant, or to at least achieve ISO 9001 compliance within the first 3 years of accreditation by DNV. The National Integrated Accreditation for Healthcare Organization standards are basically the Medicare, or CMS, conditions of participation. 2001 standards are a broader framework of principles for operating an effective organization, much like the Baldrige framework for performance excellence. Within the ISO 9001 standards is a major focus on 3 things: alignment with company strategy, effective quality management system, and consistent process of execution. It is thought that by being it is thought that by being compliant to ISO standards, high quality and clinical processes will naturally follow. This quote is from a modern healthcare article. The National Integrated Accreditation for Healthcare Organizations uses hospitals' own practices as the base of its written policies and procedures. Hospital leaders decide what to focus on and write their own plans of action, and DNV works with the facility to ensure it's following its written plan. In addition, hospital staff members become trained as auditors so they can continuously monitor their quality operations, while DNV auditors surveys. The goal is to have staff working on the same path and ensuring objectives are being met without restricting the methods used to achieve those objectives. DNV was deemed by CMS in 2008. Share of accredited hospitals has been steadily increasing since that time. Another competitor to Joint Commission has actually been accrediting hospital facilities for as long as the Joint Commission. It is known as Healthcare Facilities Accreditation Program, or HFAP. HFAP was grown out of the former hospital approval process of the American Osteopathic Association. Accreditation for acute care hospitals, critical access hospitals, ambulatory surgical centers, ambulatory care and office-based surgery, behavioral mental health facilities, and clinical laboratories. They also provide specialty certification for comprehensive, primary, and stroke-ready center designation. Or exceeds CMS's conditions of participation, with which they are aligned closely in intent and execution. In fact, 80% of the HFAP standards crosswalk to the COPs for each type of facility it surveys. The following quote is from a lead quality control officer that was key in deciding to convert accreditation from Joint Commission to HFAP instead. She says, "We had had other hospitals go through successful surveys with other accrediting bodies who weren't able to speak well to the COPs during a CMS survey. They could speak, but weren't able to train. But the HFAP process is truly an educative process. It's not punitive. And because it connects back to the COPs, it's not an interpretation. It's exactly what you need to comply. It's been a really positive experience." The newest competitor on the block, receiving deeming status in July 2013 to accredit acute care hospitals, is the Center for Improvement in Healthcare Quality, or CIHQ. CIHQ standards are primarily, about 95%, based on CMS's conditions of participation. There are some additional requirements related to key patient safety and quality of care concerns. Of all the accrediting organizations, most closely aligned with the COPs. The triennial survey window is tighter than other accrediting organizations. It happens between the 34th to the 36th month. However, organizations will also undergo a mid-cycle survey around the 18th month.
How does Joint Commission differ from its competitors? One major difference between Joint Commission and its competitors is the level of expertise and evaluation. And has been in the accreditation business for over 50 years and currently evaluates 21,000 organizations in the U.S. In comparison, Healthcare Facilities Accreditation Program accredits approximately 400 organizations, and Norsky Viras, sorry, I'm butchering that, around 350. The Joint Commission holds its organizations to a higher standard than required by Centers for Medicare and Medicaid Services and conditions of participations. One of these higher standards is the National Patient Safety Goals, which is a list of goals that all accredited organizations are expected to attain and keep data on. Another area in which Joint Commissions is different is in its offering of education and ready-made programs. Facilities put in place policies and procedures developed to improve patient safety and improved patient outcomes. What percentage of all acute care hospitals are Joint Commission accredited? Commission has accredited hospitals for more than 60 years and today accredits approximately 4,023 general pediatrician, long-term acute, psychiatric rehabilitation, and specialty hospitals, and 366 critical access hospitals. Accreditation program. Approximately 77% of the nation's hospitals are currently accredited by the Joint Commission, and approximately 88% of hospitals that are accredited in the United States are accredited by the Joint Commission. What is the meaning of the term deemed status? Who gives it? To whom is it given? If a national accrediting organization such as a Joint Commission has and enforces standards that meet the federal COPs and CMS may grant it the accrediting organization deemed authority and deem each accrediting healthcare organization as meeting the Medicare and Medicaid certification requirements. The healthcare organization would have deemed status and would not be subjected to Medicaid care survey and certification process because it has already been surveyed by the accrediting organization. What is the meaning of the term? What is the meaning of the term deemed status to who it gives to and whom is it given continued? Accreditation is voluntary and seeking deemed status through accreditation and is an option. Organizations seeking CMS approval may choose to be surveyed either by an accrediting body, such as the Joint Commission, the DMV, and the HFAP, or by state surveyors on behalf of CMS.
Accreditation surveys, an evaluation of healthcare organizations and their quality of standards compliance. Highly trained experts are called in to evaluate the healthcare organizations by selecting random patients and medical records for evaluation. These surveyors are typically doctors, nurses, hospital administrators, laboratory medical technologists, and other healthcare professionals that are qualified and trained through the Joint Commission. Also, the Joint Commission is the only organization that requires them to be licensed. The tracer methodology is the method that is used to follow the experience of care, treatment, or services for a number of randomly selected patients throughout the organization's entire healthcare delivery process. Their tracers allow surveyors to identify performance issues in one or more steps of the process or interfaces between processes. The three types of tracers that are used are individual, based on each specific patient, system, which evaluates the process of patient care and the system that is used, and accreditation, which identifies any risk points or safety concerns. Joint Commission surveys are typically done at a minimum of once every 39 months or 2 years for laboratories. And the main drawbacks of the Joint Commission are that standards aren't always related to valid criteria. They are often too political or bureaucratic for some, and then the cost is very high. Some of the other options that were mentioned earlier are HFAP and DNV, as well as others for accreditation. HFAP is more straightforward and predictable, especially for hospitals, community hospitals. Their surveyors are paid volunteers who have experience in the healthcare workforce. So they're also like nurses and physicians, administrators. And it's more closely aligned with the CMS COPs. And then the other one is the DNV, which they use the hospital's own practices as the basis for writing for written policies and procedures. So hospital administrators can determine areas of focus and write individualized action plans. They require the hospital compliance with the ISO 9001 within 3 years. They have very high standards, as well as a yearly survey, which is aimed to improve overall quality. And they are well known in the industry. That's it.
All right, great work, guys. You did a really good job covering the topic. Went really in depth, which is fantastic. Really good information there. Sorry, just a second. So at the end of each of these, I ask the students just really briefly tell me what the most interesting thing was that they learned as they were studying this topic. So I'll just start with you, Ryan, and then I'll ask the rest of you the same question as well. So Ryan, what was the most interesting thing that you learned as you were studying this topic?
I think the most interesting thing was learning that the Joint Commission isn't like a lot of people are looking for alternatives because it's expensive, and also the biggest reason was like it can be like very political and very like a lot of their methods aren't super like they're not related to things that they actually need to do in the workforce, in the healthcare administration, healthcare field. So I think like just the politics behind it was like the biggest thing.
Cool. Thank you. All right, Rebecca, same question.
Okay. Well, questions that I chose to get, I really liked how I found out that 77%, but it's approximately 77% of the nation's hospitals are currently accredited by the Joint Commission. I mean, that's a lot. That's over 50. Yeah. Understood it correctly from my research. It don't have to be. It's not a requirement. It's an option. And I just thought that was very interesting.
Yeah, no, I mean, that's a good point. I mean, it's not a requirement, but 77% of the hospitals are Joint Commission are accredited by the Joint Commission, and because it is that gold standard. And you know, I mean, it's like going to a hotel, right? I mean, if it's a 5-star, really nice hotel, you feel a little bit more comfortable. So it's the same with the accreditation factor. All right, Jennifer, same question.
I actually, I found it interesting. I did the foundation part, and I found it interesting to learn about Dr. Codman and how he was so involved in trying to understand his patients' needs and if what they were doing was working for them, to the point where he became so wrapped up in it that at the end of his life, he ended up quitting, even though he had such high status in the medical field, because a lot of people weren't buying into the fact that they needed to see the end result of what the surgeons in the hospitals were producing for patients. And I loved the fact that there were so many surgeons back in the day between 1910 and 1913 that found value in wanting to make sure their patients were being taken care of, that they actually took his idea and ran with it, and that it's blossomed into what it is today, making sure that we have confidence and safety and quality in our healthcare.
Great. Thank you so much. All right, Elizabeth, same question.
I would say I've worked in the hospital medical field for a long time, and I actually didn't know that Joint Commission had competitors. So that was a new thing for me. And when I went through and read about the main competitors, basically people who had transferred or switched from Joint Commission to these other new processes, I was really interested to learn what those processes were. Some of the drawbacks, Ryan kind of alluded to. I'll give a perfect example. One of the new standards that Joint Commission has been really pushing is drawn up from a vial that the labeled with what the medication is, what the dosage is, what the concentration is, what the date is. Miss any of those things, you get dinged from Joint Commission. Well, when you work in an environment like mine, I only work with one medication. The differences in the medication that I work with is the amount that you draw up, that you can easily see on the syringe that you use, how much is actually drawn up. So it's a little bit overkill in certain departments, and what's irritating is you get dinged on these small little details. Joint Commission essentially has the power to take away your CMS conditions of participation status, and so that is some of the negative issues that companies, especially smaller, more rural hospitals, have to see now bases everybody on. So I don't know if that makes a lot of sense, but it was just interesting to me that there are options besides Joint Commission, and that there are facilities that really like that process better, and I can actually see why.
Yeah, definitely. All right. Well, thank you guys for that presentation. It was really good. I'm gonna go ahead and stop recording right now, but stay on the